I will be talking about the inflammatory brain, how chronic inflammation can impact cognition and neurodegenerative disorders. And just a little disclaimer here, this information is provided for educational purposes only. It does not constitute medical advice or establish a patient-physician relationship. If you have any questions that are specific to you regarding this information, it's really important to follow up with your personal physician regarding that. Another intro slide, but Allison did such a wonderful job. Thank you. My clinic, Rehability MD, is located on Dover Drive in Newport Beach. So right where 17th turns into Westcliff and then tees at Dover. And I always share that one of the reasons why I founded my own clinic and why it is in this specific location is because it's really important for me to be present within my community as well as for my family. And this spot is within walking distance of anywhere my kids will go to school. So that was really important for me as I was looking at how to serve my community with this clinic. So today we're going to talk about inflammation and the impact on neurodegenerative diseases. The disease model that we are primarily going to use is Alzheimer's disease. Alzheimer's disease is well studied. That being said, we certainly do not know everything that there is to know about it. Alzheimer's disease is marked by accumulation of amyloid beta plaques. There are some other proteins that can also accumulate with Alzheimer's, but we are going to focus primarily on the amyloid beta plaques and how inflammation causes this cascade that can ultimately result in Alzheimer's disease and other types of neurodegenerative processes. And then we'll also touch a little bit on what you can do yourself in order to help manage neuroinflammation and decrease the risk of developing these types of plaques that can lead to these types of diseases. I like this picture here because it just gives us actually an image of what those plaques actually look like under a certain type of microscopic imaging that they use. So those are amyloid beta plaques that have been stained and then magnified under a microscope. This slide here, I highlighted in order to give us a little bit of an overview of some of the different types of neurodegenerative diseases, as well as to highlight some of the different areas within the brain, and then also the central nervous system, including the spinal cord, where these types of neurodegenerative issues can occur. Like I mentioned, we're going to be focusing primarily on Alzheimer's disease, and we can see that Alzheimer's disease on this picture is represented by those little yellow triangles, and that occurs primarily in a part of the brain called the cortex. But there are other areas where Alzheimer's can sometimes affect lower within the brain, and these are more primitive brain structures, meaning that they evolved much earlier than the cortex. And that becomes important when we talk a little bit more about how our bodies have evolved or not evolved to respond to stress. So that's why I make a little bit of that differentiation there. We can also see that multiple sclerosis can affect areas both within the brain, especially the cortex, as well as within the spinal cord. And then we have some other degenerative processes here, such as frontotemporal degeneration, which occurs in a more specific part of the brain, different from Alzheimer's, as well as Parkinson's disease. We're not going to touch too much on Huntington's disease today. Huntington's disease is a primarily genetic disorder that can cause difficulties with movement. Now, here's another slice. And what I like about this is that it is highlighting, again, the different parts of the brain where some of these neurodegenerative disorders can occur. But then we are also seeing some actual anatomic representation of where these spots are affected in the brain. And these are sections that have been stained to show us where this degeneration has actually occurred. So we can see that multiple sclerosis, again, can affect the cortex as well as the spinal cord. Then we see that Alzheimer's disease tends to affect more this temporal parietal region. We talked a little bit about another type of dementia that can affect the frontotemporal region. And then Parkinson's disease, which many of us may be familiar with, tends to affect the parts of the brain that carry dopamine neurons. And dopamine is a very important neurotransmitter. As we continue, we'll talk a little bit more about that neurotransmitter level and how inflammation can impact the neurotransmitters and how they send information from our brain to our body, and as well as from our body up to our brain. Again, here is, I love talking about anatomy. This goes back to my philosophy that my first role as doctor is teacher. So this is another more standard depiction of the brain anatomy. And you can see some of those different structures that we talked about in terms of the types of neurodegenerative diseases that can occur, but we're talking more about the actual anatomical names for those different locations. Some of the different areas that we're going to talk about today are, we mentioned the cortex or the cortical regions, which tend to be white because of a substance called myelin that coats the axons, versus the subcortical regions. And the subcortical regions tend to be gray. And that part of the brain is composed mainly of cell bodies. And you may have heard of gray matter versus white matter. And that's actually where this distinction comes from. So again, the cortex is white matter, and that white matter primarily comes from the myelin that surrounds the axons. And then the subcortical region is the gray matter. And that's because it is composed primarily of cell bodies. We are also going to talk a little bit about the autonomic nervous system, because the autonomic nervous system is how your body reacts and responds to stress. And as we're going to learn as we go through this presentation, stress of many different types is one of our primary instigators of the inflammatory cascade. So coming here to the autonomic nervous system, autonomic nervous system might not be a familiar term, but I would suspect that many of you have heard of fight or flight. So the fight or flight nervous system is one half of the autonomic nervous system. The fight or flight part of it is known as the sympathetic nervous system. And then the parasympathetic nervous system is the rest and repose. We don't tend to talk as much about the rest and repose aspect of the nervous system, but that's actually what helps us recover after we've had that fight or flight experience. So fight or flight, and we've all experienced this at some point in time, it is when all of a sudden your hearing becomes super acute. You feel your heart rate start to go up in response to something startling, like even a loud noise in the middle of the night, or seeing somebody or something jump out at you while you're walking your dog at night. Again, that's the fight or flight nervous system, known as the sympathetic nervous system. And the neurotransmitter, or the chemical that our bodies use to help control that, is epinephrine. After you've had that fight or flight response, when you're walking your dog and you realize that, oh my goodness, okay, that's just a raccoon that fell out of a tree. It's not something that is going to chase me down. Then your parasympathetic nervous system kicks in to help bring that heart rate back down. And I'm talking about this primarily in the sense of how it affects our heart rate, because I think all of us have felt that sudden onset of fight or flight. But as you can see from this picture, this type of part of the nervous system actually affects much more than just our heart. And we'll talk a little bit more then about how, especially the fight or flight side, can trigger that inflammatory cascade, as well as how we can harness our parasympathetic or rest and repose side in order to help manage that inflammatory cascade. This here is a picture of a protein within our brain that is very important when we're discussing Alzheimer's disease. We mentioned the amyloid beta plaques, and the amyloid beta plaques are actually a product of this protein here, which is called the amyloid precursor protein. The amyloid precursor protein is active within the brain and helps our brain to create new connections. So our brain has what we call neural plasticity, meaning that after some type of injury, our brain has the ability to try to create new connections around that area of injury so that we can recover. And that amyloid precursor protein is very important in that role. Now, what can happen is that the amyloid precursor protein then gets broken down as it wears out. And if our body is not clearing that amyloid precursor protein, then it can build up and turn into those amyloid beta plaques. We'll go into a little bit more detail about this now. So, in order to have a better understanding of this process, I'm going to talk about the blood-brain barrier. The blood-brain barrier is this anatomical structure that helps to protect our brain. So it's composed of different cells and proteins, and it's evolved to help prevent potentially toxic substances within the blood from diffusing into the brain and hurting the brain. As we can see from this diagram here, the blood-brain barrier surrounds the blood vessel itself, and it consists of a couple of different types of cells, including the endothelial cell, which is the cell that primarily makes up your blood vessel, as well as some other supporting cells, including astrocytes, which are very important when we talk about that inflammatory process, as well as parasites. Pericytes, I should be sure I say not parasites. And this, I like this picture because it just really gives us this cross-sectional view to help us understand the role of the blood-brain barrier and where it's located. I also have there two other bullet points, claudins and occludins, and those are some proteins that we're going to talk about because they're important in maintaining the blood-brain barrier. But what can happen is that this blood-brain barrier can become compromised or injured and then allow some of these inflammatory mediators or inflammatory chemicals to get into the brain and contribute to some of this degeneration that we're talking about. And so, as I mentioned a little bit, the role of the blood-brain barrier is to make sure that any harmful toxic substances are not able to cross from the blood into the brain. Now, that being said, of course, we want oxygen and carbon dioxide, which help to power our cells to be able to diffuse back and forth. And then our body also makes hormones that are really important for our brain to use, such as glucose, leptin, insulin. Leptin is the hormone that tells your stomach that you're full. So if we don't have leptin that can cross over into our brain, then our brain is never going to be able to sense when our stomach is full. So our blood-brain barrier actually has some other structures within it in order to specifically carry these different types of signaling hormones or chemicals across. And then I also wanted to highlight that there are some chemicals that we know can fairly easily cross the blood-brain barrier. So caffeine, that's why we can all get that little mental perk after our coffee in the morning, as well as alcohol and then anesthetics that are used for surgery. Unfortunately, illicit drugs like heroin, but then also B vitamins. And I specifically highlight B vitamins because B6 and B12 are particularly important for helping to maintain our nervous system as we age, so especially B12. And so I mentioned that there are factors that can impact the blood-brain barrier. And we're going to go into those in a little bit more detail. But one thing that is really important to note is that the blood-brain barrier is where those pumps are that can help to get that amyloid beta plaque out of the cell. Now, both neural inflammation, which we're going to talk about, and glutamate, which has a role in neuroinflammation, can impact the ability of those proteins within the blood-brain barrier to help carry those waste products, that amyloid beta plaque, out of the cell. So now we have that connection between how neural inflammation can contribute to the onset of a neurodegenerative disease like Alzheimer's, because it makes it more difficult for the blood-brain barrier to get those proteins out of the brain. I highlight glutamate because glutamate is released with a brain injury or brain trauma. And we also know that glutamate can impair this process as well. Here is, I'm big on pictures, so I have a lot of different diagrams and illustrations in this presentation. So I like this one because it really helps to highlight what a normal blood-brain barrier looks like on the left. And you can see there that we have those salmon-colored rectangles are cells of the blood vessel. And then we see that we have those proteins I talked about, the occludin and the claudins, that help to keep those proteins nice and tight together and to stop substances like that toxin there, represented both by those two little purple circles, from being able to pass through into the brain structures below. Then we look at that diagram on the right, and we can see that our claudins and occludins proteins are not there anymore. We've got that separation between our endothelial cells, and then that's allowing those toxins to pass over into our brain tissue that is marked at the bottom there by the pericyte, the astrocyte, and then the microglia. And the microglia will become more important later as we talk more about that inflammatory process. I wanted to talk a little bit about the general physiology of inflammation, or the chemical basis of how our body creates inflammation, so that we have a little bit of a background understanding of this. Inflammation is important. Our bodies evolved inflammation in order to make sure that when we were cavemen, if we got a scratch while we were out gathering berries or trying to take down a saber-toothed tiger for dinner, that our bodies could heal from that scratch, and that scratch wouldn't become lethal. So the problem is that, and I'll get to this a little bit later, is that now our bodies can have an excessive inflammatory response that continues and causes that neurodegenerative process. We can see here that we've got the bone marrow, and then within our bone marrow, within our bones, particularly our long bones like our femurs, our thigh bones, or our arm bones like our humerus, that's where our blood cells are created that help to drive this inflammatory cycle. Then as this inflammation is occurring, it actually creates some of those changes that we talked about with the sympathetic nervous system. So we see that the blood vessels can get larger, and that's to carry more blood to an area of injury. We can see that that's how we get issues like swelling, heat, and redness at a site of an injury. And then we can also see that there are some other systems that come into play in order to help manage that inflammatory response. One that is important is one down here called phagocytosis, and you'll see that in the middle of the screen in that tree down in the bottom there. And that is the body's way of kind of chewing up non-native substances. Like if you've ever had a splinter that eventually kind of tried to wall itself off, that's actually a phagocytosis type of response. This also becomes important when we're talking about the brain because the brain has a very similar mechanism for trying to wall off and get rid of any of these toxins that do manage to make it through. And then heading on to the next slide here. I like this slide because it really helps to bring together the inflammatory mediators. So in that picture on the left, we have some of the different cells that are active in inflammation, and then the types of inflammatory chemicals that they produce. Some of the ones that are most commonly discussed are IL-6 and TNF alpha. So if you're going to try to hold on to two of those inflammatory chemicals to remember, IL-6 and TNF alpha are two to hold on to. Then if we go over to this picture here on the right, then we start to really see how this ties in to the inflammatory process. You can see that that little picture up at the top, that little cell, the microglia, is one of the cells that we looked at previously in the brain tissue, in the nervous system. And this is one of the primary cells that gets activated with inflammation. So you can see that we've got that TNF alpha is one of our pro-inflammatory chemicals that's listed there. And that TNF alpha acts on the microglia in order to create this inflammatory cascade. So then it releases more inflammatory mediators that then you can see we do have IL-6 down there, comes down, it releases glutamate. And like we talked about, glutamate is one of those substances that can then impact the blood-brain barrier and make it not as effective at preventing these substances from getting into the brain. Some of the factors that influence neuroinflammation are the ones actually that we can target to try to help stop this inflammatory process and protect our brains from that inflammatory cascade that can cause degeneration. I've got a couple of bullet points here, and some of these you might be familiar with. Of course, we talk about sleep. We talk about nutrition. I very specifically use the word nutrition and not diet because diet is a 4-letter word. And we have diet as a bad connotation, but nutrition is nourishment. And we actually all need good nourishment for our bodies. But I highlighted down at the bottom that what each and every single one of these bullet points is a type of stress. Now, the thing about stress is that, apologies, I'm going to skip over this because I've got it a little bit later, is that you can see here on the right is what stress looks like in our day-to-day life now. Somebody who's been exhausted from staying up late to work on a report for work. He falls asleep at his desk in front of not one, but two screens. And then on the right, on the left, we have a picture of a saber-toothed tiger. So our bodies evolved to manage the stress of a saber-toothed tiger, but they've not evolved to recognize that our stressors today don't need the same response that the saber-toothed tiger did. If you think about our ancestors, one of these saber-toothed tigers started chasing them down. In order to survive, they needed that sympathetic nervous system, that norepinephrine, to kick in and tell their heart to beat faster, tell their lungs to open up more so that they could get more oxygen in, tell their blood vessels to expand so they could get more blood down to those muscles and run as fast as they can, and to tell their eyes to take in more light so that they would be able to see these threats around them. But the problem is our stress is no longer a saber-toothed tiger. Our stress is now a work report. Our stress is now worrying about how to get the car fixed. Our stress is now thinking about, I've got to deal with that annoying neighbor who keeps complaining about how loud my gate closes. And our stress today still triggers that same response. So even though our bodies don't need to outrun anything to deal with opening up a piece of mail that you know is going to have a bill that you wish you didn't have to pay, our bodies still react the same way. And because we don't have the same cessation or stopping of stress, that parasympathetic nervous system or that rest and repose nervous system doesn't get a chance to kick in and kind of put the brakes on the entire inflammatory cascade. So you can imagine that if you were outrunning a saber-toothed tiger and then all of a sudden you made it into your cave and behind the boulder and the saber-toothed tiger couldn't see you and you were safe, you get that breath of relief. Your body gets that parasympathetic nervous system kicking in and bringing everything back to a resting state. In our current lifestyle, unfortunately, these stressors just keep hitting us. And so our parasympathetic nervous system doesn't ever really get a chance to kick in unless we actually ask it to or try to activate it. And we'll talk more about that as one of the ways that you can help manage neuroinflammation as well. One of the other factors that is really important in neural inflammation is talking about our gut-brain connection. I love this slide here because it helps to highlight some of the neurotransmitters or the nerve chemicals we know are active in the brain and how they are also active within the gut. You also have a nervous system entirely within your gut. And so one of the things that I really want to highlight here is I would imagine that many of you have probably heard of serotonin before. Serotonin is one of our feel-good hormones. It's one of the hormones or the neurotransmitters that helps us to maintain a good mood. It helps to prevent depression. And you can see that serotonin, we know we've got serotonin in our brain. We actually also have serotonin in our gut. You can see here too that we have the vagus nerve, and the vagus nerve is coming down here and it's actually interacting with these barrier cells that make up our gut. And you can see here, look at this. We've got glutamate. Remember, we talked about glutamate being one of those neurotransmitters or one of those chemicals that can contribute to our inflammatory process. And so here we've got this connection here between the glutamate within the vagus nerve impacting the lining of the gut here. Another thing that's important to note about the vagus nerve, apologies, is that the vagus nerve is actually a big part of the parasympathetic nervous system or that rest and repose nervous system too. So it's really important for that. We also have down here, we have various representations of different bacteria within our gut. And the bacteria within our gut are actually hugely important for helping to make sure that we maintain a healthy immune system as well as a healthy nervous system overall. And we'll get into that a little bit more. We'll talk a little bit more about that later. This is another slide that takes the previous picture and brings it really down to a micro level. So you can see here that it shows us actually the gut microbacteria, or you may have heard of your gut microbiome. And it shows us how these bacteria then can cross into the cells that line your GI tract, and they produce what are called short chain fatty acids. And these short chain fatty acids can actually help put the brakes on the inflammatory process. If you don't have a wide diversity of bacteria within your gut, then actually it's a lot harder for your gut to make these short chain fatty acids and help to decrease that inflammatory process. Some other factors that can influence neuroinflammation are some factors called catastrophizing. And catastrophizing is when your brain gets into that runaway state. It is trying to manage some type of stress, and then all of a sudden, you never get a chance to let go of it, and it just keeps thinking about the worst case scenario, and you have a hard time stopping it. So again, this is where in our current day and age, our bodies don't get a chance to actually activate that parasympathetic, that rest and repose response. So our sympathetic nervous system gets carried away, continues on with this catastrophizing. And that catastrophizing, or that constantly worrying about the worst case scenario, actually causes an increase in IL-6. Remember, I said to hang on to that because IL-6 is one of those inflammatory mediators that we know is active and eventually contributing to the formation of the plaques for the neurodegenerative disorders. Interestingly, having a hostile affect is also associated with elevation of IL-6 as well as another inflammatory chemical. And so I take this as a sign that, like, okay, even when my neighbor is complaining about my gate banging too loudly, I need to remember to activate my parasympathetic rest and repose nervous system and not let myself escalate this hostile situation. Some other factors that impact neuroinflammation: sleep. Sleep is a huge one. And we now know that sleep deprivation increases release of a lot of these chemicals that are associated with inflammation. In today's society, we use so many screens that actually can really impact our sleep cycle and the quality of our sleep. And another thing that I like to remember about sleep, I used to think that sleep was totally boring. Why would we talk about sleep? You're doing nothing for 8 hours. Your brain is actually actively recovering during those times that you're asleep, and it needs different stages of sleep in order to complete that recovery process. And if you think back, there must be a reason why we sleep. It doesn't make sense that if sleep wasn't important, that we would have survived being unconscious for 8 hours out of every day when there was that threat of that saber-toothed tiger chasing us down. So we know that sleep is hugely important. We would not have evolved to where we are today if we didn't need sleep. We'll talk a little bit more too in a little bit more detail about sleep hygiene and what that looks like and how that can help. And this is just a nice Venn diagram that shows us how different factors that can sometimes be a symptom of inflammation really tie together. So again, we've got that IL-6 and the TNF alpha, and we see that fatigue, which I'm sure we've all experienced, pain, as well as I dislike the term psychological disturbance, but maybe that catastrophizing, that feeling a little bit depressed, how all of that can then meet in the middle to really elevate those inflammatory chemicals. Again, here's another one that really looks at then how these inflammatory chemicals go on to affect our nervous system. So we've got a neuron right there in the middle, and then we also see that we've got a microglia, which, remember, we talked about as being very important in this inflammatory process within the nervous system, as well as an astrocyte, again, another part of the nervous system that is important in this inflammatory process. And we can see that we also have over there on the right side of the screen, talk about that lysosome. And so that lysosome is really important because, remember, we talked about how your body can try to wall off or excrete substances that are harmful in order for the body to protect itself. The lysosome is basically the body trying to do that on a cellular level. So that lysosome is going to try to wall off any toxins that have made it into the cell and spit them back out so that the cell can remain healthy. We also show that inflammation, which is marked by increased white blood cells, and then also that CRP that we talked about. We can actually see a correlation between Alzheimer's disease or plaques, amyloid beta plaques within the brain, and these markers of inflammation. Another factor that unfortunately is unescapable for all of us regarding the impact on inflammation is aging. And so we know that as our body ages and some processes generally start to break down a little bit, that can contribute to some of this inflammatory cascade and then the formation of the plaques. But what we also know is that we have a lot of things that we can do that are within our own power in order to try to help mitigate these impacts of aging. Now there are actually even some tests that look at what your biologic age or your metabolic age is compared to your chronologic age. So sometimes you can go and you can get a series of tests that might show, okay, well, my age based on my birth certificate is 45, but maybe my biologic age looks improved because I've been doing more exercise, I've been eating more fiber. So we'll talk a little bit more about some of the ways that we can actually help to manage this inflammatory process that is inevitable even with aging. And now segueing right into that, managing neuroinflammation. What I've done here is I have taken some titles of various research articles that talk about ways that are all within our own power in order to help manage neuroinflammation. So this one is grounding, and grounding is merely standing outside in your bare feet with your feet on the ground. And we actually have studies that show that that can help reduce inflammation. Here we go. Here's one about sleep disturbance and the impact on inflammation. How plant-derived chemicals from a plant-based diet can be protective against inflammation. Time outdoors. I love this one. This one showed that the more time we spend outside, the more that we can help decrease our inflammatory load. And also even having houseplants can help to decrease our inflammation. Mindfulness. We'll talk a little bit more about mindfulness, but mindfulness is basically making it a point to try to activate that parasympathetic nervous system. So recognizing, okay, I've got this stressor here. This stressor, this deadline is not going to attack me in the middle of the night. And I can take this moment now to activate the parasympathetic nervous system and help stop that inflammatory cascade. Many of us have probably heard of deep breathing. And one of the reasons why deep breathing works is because when you take in that big, deep breath and then you hold it, you stretch out your diaphragm, and that actually helps activate that vagus nerve. Remember a couple slides ago, we talked about how the vagus nerve then communicates with our inflammatory system and our nervous system within our gut and activates that parasympathetic, that rest and repose part of our nervous system to help stop that inflammation. Here's a couple more. The gut microbiome we touched on, as well as our current, they use the word diet, but I said I'm going to stick to nutrition, how our nutritional sources can impact inflammation. And so here's a little graphic I found that there were some things I liked about it and some things that I didn't. I think that when they were initially making this graphic, they must have made an error, because you can see that the left side of the graphic has good things. It's got fish, it's got running, it's got fruits and vegetables, it's got coffee. But then I also, they accidentally put cigarette on that side of the graphic. And clearly cigarettes, we've come to find out, are not going to be helpful and are going to be very detrimental for trying to manage inflammation. The other one that I put that little no sign over is wine. And our understanding of wine and how it impacts our inflammation has really been evolving over the last couple of years. I will be the first person to tell you that I am never an all or none. I am somebody who is always, always, always going to talk about moderation. And I'm never going to say that somebody can't have any of anything unless there's an underlying medical issue, like someone who has a lactose intolerance and really, or an allergy and really can't have dairy. Um, but our understanding with wine is that the studies that were initially done now about 15 to 20 years ago that showed positively a healthy impact from wine were actually misinterpreted, and they did not group the subjects the way that would have been most statistically appropriate. Now, that being said, if you are someone who enjoys wine in order to sit down and chat with friends, that's not necessarily a no-no. And we'll actually talk a little bit more about the importance of social connection in managing inflammation as well. But I just wanted to highlight a little bit of our evolving thinking, especially surrounding wine. So when we look at managing neuroinflammation, many of us think about supplements. So we've got curcumin, vitamin D, and omega-3 fatty acids have all been shown to help decrease the inflammation that impacts our nervous system. We talked about sleep. So one of the best ways that you can really try to help improve your sleep quality, which is going to help your brain recover overnight and get more of those inflammatory chemicals out, is by limiting your screen time, particularly before bed. And so you want to try to stay off of any type of screen for ideally an hour before you go to bed. Now, I will admit that I'm not always perfect at this, but it's something that when I do it, I also notice that I sleep a lot better. I wake up a lot more refreshed the next day. Um, and it's, again, not an all or none scenario. If you are someone who can say, okay, I can put my phone away 10 minutes before I go to bed, great, fantastic, because that little change can then eventually get us to a bigger change. And talking about little changes, let's also talk about exercise. So exercise is not a surprise that it positively helps inflammation. It actually doesn't have to be a really high intensity exercise. Moderate intensity is enough. There are some new studies coming out regarding different ways that we can exercise to help decrease inflammation and to help improve our endurance. One of the ones that I like right now that I've been experimenting with is called an interval walking technique. And this came out of Japan. But basically, it's walking for 3 minutes at a very brisk rate, where you feel like, okay, I can maybe get 3 or 5 words out, and then I have to take a breath, and then giving yourself a chance to recover and walking at a much more slower rate for 3 minutes. And repeating that for 30 minutes a day has actually been shown to have a significant benefit on inflammation and on endurance. So again, it's never an all or none. It's always about what you can do and where you're at to build things up. Looking a little bit at nutrition, I talk a lot about fiber. And the reason why is because we mentioned the gut microbiome. And the way that you feed all those billions of bacteria within your gut and keep them healthy is with fiber. And one of the things that's happened is as our society has progressed, we've gotten more reliant on foods that tend to have less fiber. It's become a lot easier and a lot quicker to grab. You've probably heard of ultra processed foods, to grab something that is ultra processed rather than to actually make something from scratch that is going to have more fiber in it. Protein. Protein is also really, really important. And as we get older, our muscles start to age and degenerate on their own. By the time we're about 80, our body has probably lost about half of its muscle mass unless we have been concertedly working on maintaining strength through strength training and protein. And maintaining our muscle mass is hugely important because, in addition to helping to prevent falls, our muscles, when we exercise, are actually the organ of the body that helps to decrease that inflammatory response. So, our muscles are really, really important. And we can help our muscles out with strength training as well as eating more protein. And I have a couple of great recipes. I actually prescribe recipes pretty frequently in my clinic, but I've got a couple of great ones that involve chickpeas, involve great northern beans. So you're getting both that fiber and that protein aspect of things. Then let's talk a little bit about mental health. So we talked about mood and we talked about how serotonin is actually active within the gut, in the inflammatory cascade that eventually reaches the brain. So we know that um, looking at our mood as one aspect of our health is hugely important. And this is where it's been so heartening to see our thoughts and our knowledge and our research evolve over the years. We now can recognize that an issue like depression is not weakness, it's a disease. And just like blood pressure, it needs to be managed. Someone develops high blood pressure, or also like with obesity, someone develops cancer. It's not something that we say, oh, this is something that we need to shame away. We need to manage mood the same way that we manage any other disease. I also noted on their social engagement. We actually have studies that show that when we are isolated, when we are lonely, that our inflammatory chemicals increase, that IL-6 increases within our body. And so being socially engaged and maintaining social connections and friendships is a hugely important way of helping to decrease the inflammatory process that can contribute to that neurodegenerative plaques. I also wanted to talk a little bit about how patients can access information. I know that sometimes it can be really intimidating to go into a doctor with something that you learned online, because sometimes physicians, nurse practitioners, PAs, any clinician can unfortunately be dismissive of information that you've gone to seek out on your own. And what I always try to do is I want to honor for my patients that those patients are that you're interested in your own health, that you're going out and you're finding these resources because it's so important to you. So I always like to provide a little bit of information regarding how we look at the sources that we're using. So one of the things that I love to start with is talking about correlation versus causation. Now, correlation is when two things happen to occur at the same time. And actually, the graph that I saw in medical school that highlighted this for me was a graph that showed these two lines that really mirrored each other over the course of a year. In January, the both lines were pretty low, and then they really spiked over the summer months. And so when you see that graph without the headings, you think these two things must be related. One must be causing the other. That graph that I saw was shark bites and ice cream sales. Ice cream sales do not cause shark bites, but we can understand how both of them are going to be increased during the summer months. So I like this graph that I found here. So it turns out that UFO sightings have increased. UFO sightings specifically in Rhode Island have increased, as have the number of people to successfully climb Mount Everest. Now, I think we can all pretty safely come to the conclusion that UFO sightings in Rhode Island are not causing people to be more successful in climbing Mount Everest. And this is where it's really important to remember that you may see something on social media or in the news that makes it look like, wow, we've seen an increase in this over the last 10 years. And so it must mean that it's being caused by that. And that's not often the case. Most of the time, it's not the case. So always remember when you're looking at some of these trends that, okay, we might see that both of these things increased at the same time, or that decreasing something caused something else to increase. But it could just be the relationship between UFO sightings in Rhode Island and successfully climbing Mount Everest, or ice cream sales and shark bites. So another way that you can really help to look at the information that you're consuming is to consider the source. So If this is coming from one person on TikTok, look at that person's credentials. There are some people out there on social media who are providing really, really sound evidence-based information. Look at, okay, what's their level of training to be able to talk about this specific type of information. If it is someone who is fellowship trained in gastroenterology, talking about how a certain type of food might impact our gut, then that's someone who has a basis of that information. If it is nail tech who's got a lot of followers on a page where she usually shows manicures talking about how, you know, she ate one type of food one day and her stomach felt better the next, well, then we're touching on both the source as well as the correlation versus causation. Another thing to consider is risk versus benefit. So when we talk about things like supplements, I like to talk with my patients a lot about supplements because they're so much easier for folks to access. And that can be really empowering. It can make someone feel like they have more agency and they have more control over what's happening. But I also want to make sure that we've got good sources for looking at the risks, and I'll provide a resource in the next slide or two. And then also talking about the benefit. So generally speaking, if we're talking about something like vitamin D, and we've got a lot of different information out there on vitamin D. Vitamin D can help bone health. It can help decrease fall risk. It can actually help manage neuroinflammation. Do we have the causation aspect of all of that? No, it's largely correlation, but what's the risk? I mean, our risks of vitamin D supplements are generally speaking pretty low. And so the other way that I also encourage people to think about this is think about what is uniquely important to you. So there might be a benefit that is really important to you that doesn't cross your physician's radar, and that's okay. I always want my patients to recognize that what's important to them is important to them. And because it's important to them, it will be important to me too. One thing I do caution my patients a lot about is looking at financial investment as a risk. Unfortunately, we do still have snake oil salesmen, only they look a little bit different today. But I had a patient come in a couple of weeks ago, and she wanted to know if she should buy a supplement that was being sold by somebody down in South County who scanned her with a cell phone app and told her that she had some type of liver parasite. And of course, the supplement was going to cost like a couple $100 a month. Now, I can't make that decision for anyone, but I always encourage people to think about their own personal values, their financial investment, and how that impacts their risk versus benefit. Then I also have that bullet point down there called an N of question mark. So when we talk about N, we're talking about the number of folks that have been involved in research. So if I go back to my nail tech explanation, you know, somebody who does manicures talking about eating a food that made their stomach feel better, that's an N of 1. If we talk about a large randomized controlled trial, that is likely going to involve hundreds, if not thousands of people, and they've been carefully matched in order to help minimize the impact of any differences between those groups. So as physicians or healthcare providers like Allison, when we talk about evidence and how we make recommendations, we're going to talk a lot about that N, and we're going to give more weight to something that has been studied in a larger group versus something that is anecdotal or an N of 1. Now, that being said, I also tell my patients that nobody's body has ever bothered to read a textbook or a journal article. And so as we take this information, it's really important to make sure that it is tailored to each person and what their individual scenario and goals are. So here's a little bit more information. So I don't know how many of you have tried to play around with ChatGPT, but there's a lot out there right now about AI and about how AI is going to be used in society and in different aspects of our lives, including our healthcare, over the coming months to years. The issue with ChatGPT is that ChatGPT and a lot of basic forms of AI can hallucinate. And that means that they can use correlation, or they can take two totally unrelated things that it stumbles upon and come up with this idea that is a total hallucination, not based in reality at all. These AI models that I've noted here are ones that will actually show you the sources that they've pulled the information from. Open evidence is, I believe it's under the Google umbrella. It does require what's called an NPI number to register. So you have to be like a healthcare provider, a therapist, a physical therapist, a nurse, a physician, a PA, in order to access that one. But the other two, Perplexity and Consensus, those ones you don't need to register at all. You can type them in to Google, go to their page, and you could ask a question. So I think I asked Consensus a question about neural inflammation and supplements, and it spit back a list of different research articles that talk about that subject. And then Perplexity will actually give you a summary based on the question that you're asking it. And then it will give you the resources that it used in order to develop that summary. One app that I use all the time in my clinic, and I really, really encourage for my patients, is called About Herbs. And this is a free app that is maintained by Memorial Sloan Kettering, and it provides evidence-based information regarding herbal supplements. And it includes even herbal supplements that can interact with different types of drugs. So this is a really important app if you're someone who is taking any supplements at all. Another note about supplements, and apologies, I did not create a second or a separate slide for this, is that part of the reason why physicians will oftentimes shy away from talking about supplements is because supplements are totally unregulated. And what that means is it means that the manufacturer of the supplement can put whatever they want on the label, and they're actually not legally obligated to put any of that into the bottle. So there have been studies done where they've taken really common supplements, even say St. John's wort, from large big box retailers like CVS, and they have taken multiple samples and they've run purity tests on them. And even when they're coming from the same lot from one of these big box retailers, it will show that there might be none of the active ingredient in the supplement, or it might have 2 or 3 times the listed amount of the active ingredient in the actual supplement. One thing that you can do is that there are a couple of labs that do purity and consistency testing on supplements. One of them is called NSF. And if you are someone who does use supplements, you can look for supplements from companies that send random samples of their product out to a lab like NSF for purity and quality testing. So that's something that that I recommend because otherwise there's so little regulation surrounding supplements that it's actually really hard to know that we're providing a consistent recommendation. So I have a couple of slides of references here. I won't bore you with them, but just to show that I walk the walk as much as I talk the talk. I used multiple different references, and some of which I found through open evidence in order to create this presentation today. And I thank you all. It really is such a privilege to have a chance to share information and education. And with that, I'm open to any questions you all may have.